Southgate here from Pilates Therapy and the Core and Burn Down. We are going to look at the knee to wall test, which is an ankle dorsiflexion test looking for restriction or limitation of dorsiflexion at the talocrural joint. So that's important to say because in this test we're not letting the foot pronate, so that's limiting that movement to the talocrural joint and how much available movement there is there. So this test you can assess both the front and the back foot for restriction. If it's the front leg, then we would be looking at the soleus because the knee is bent, and the back leg, the knee is straight, which would mean we would be looking at the gastrocnemius causing the restriction of the dorsiflexion. So Alex has got his toe to the wall. I'm adding a centimetre on. I've measured because I've got skirting, and if you're doing this test you need to make sure that you take that into account. Alex is now going to bend his knee, and I'm going to hold his foot under his instep and his heel, and I'm feeling for pronation or a lift of the heel here. So he's absolutely fine there, so we're going to have him start to scoot his foot back, and he's going to repeat this until I feel a change in the foot. So either the heel wants to come off or the foot wants to pronate. So we're going to take him there. See how you go there out. Now, yeah. Ooh, we're still just okay there. Take your foot back a little bit more. And back a little bit further. So you're going to inch your client's foot back, taking that knee in. There we go. I could start, probably that would be the last point that we would allow. So if I measure the distance between his big toe and the wall, and then we're going to add a centimetre on. He's got his toes at 7 centimetres, so that gives him 8 centimetres from his on the knee to wall test. So normal would be considered 8 to 12 centimetres, so Alex is in the normal range, so he would have been good for that test. So if you bring your foot back onto the wall for me, Alex, or you can bring it back where you were and bring that knee to wall. So the other thing we can be looking at here is the back foot. So what you might find is they're okay with the front foot, but the back heel starts to lift off, and that would be an indication that his gastrocnemius was pulling that heel off. The front leg would be an indication of the soleus because the knee is bent, taking out the gastrocnemius. So it's a test for both things, looking at the restriction of dorsiflexion, which can lead to the likelihood of injuries and problems, so it's important to look at. So that is the knee to wall test. Thank you for watching.